According to the World Health Organization, a doctor is supposed to see up to 1,000 patients, but in Kenya, the doctor-patient ratio is 1 to 16,000.
Approximately 40 to 50% of Kenyans who are today went out for treatment in an outpatient department, mainly in our public facilities, are most likely to be back within the next 2 to 3 weeks with similar symptoms or same symptoms.
This has been attributed to inadequate medical personnel at all levels of medical facilities. Doctors further rely on limited knowledge they receive from patients to prescribe medication without necessarily conducting further tests.
This person is like trying to diagnose what is in a room by looking through a keyhole.
At the same time, local health facilities do not provide adequate care, and thus 80% of the diseases that would be treated in clinics and dispensaries overflow onto level 4, 5 and 6 hospitals.
Patients don't go there. They say hakuna matibabu huko because counties are offering free services in those facilities. So naturally, they don't provide a lot of supplies in those facilities.
Each of these levels are not just based on the structures that have been built, but they're based on the service that they can provide.
The Doctors Union KMPDU says the solution for qualified doctors to be hired in order to fill the human resource gap is a responsibility that should be reinstated back to the national government.
Over 72% of Kenyans who love to go to the public hospitals, but because they go to the public hospitals and they don't get the services that they deserve to get in those facilities, because there are no personnel, they end up ending in the private facilities. And that's why we have higher retention rate in the private hospitals, because the cost becomes much higher.
A clarion call has been issued to the political class to involve stakeholders in the health sector in discussions on how to improve Kenya's healthcare system. Ben Kerera, K24, Nairobi.